Do you know somebody in healthcare that has gone through an acquisition? The company they work for is being bought out and they take over and everything changes. It's happening all over healthcare and it is a major problem. You see, one of the big things that we're noticing is that these big corporations are realize that there's a lot of money to be made in healthcare. And so what they are doing is they're going out and buying all the providers that they can find, independent providers, kind of like us, that are smaller, and they buy them up and then they take them over and then they make all these changes. And all these changes hurt the consumer and they hurt the employees, because at the end of the day, they're businessmen and they're there to take money out of the system, and they'll do whatever it takes to do that. And unfortunately, a lot of times that means cutting corners in care, and it means cutting corners in taking care of the employees. And that's why we don't agree with large corporate healthcare companies. We believe that the small, clinician-owned, locally owned companies are what is going to provide the best care, because my wife and I live in Springfield. We cover Southwest Missouri, and we believe that we have an obligation to take care of our community, and we have an obligation to take care of our fellow clinicians, because my wife and I raised a family in healthcare, and we have quite a few horror stories to tell about how these big corporations will treat people like numbers, and they're not spending the time and energy into making sure they have good leadership and making sure that they're, they just throw money at things and then hope that things get better, and then they make changes and they pull that money back. And these clinicians, a lot of times, they think at first it sounds like a great thing, but then they find out it's not. And so we've had a lot of people who've come and go from Haven and then decided they wanted to come back because the grass wasn't greener and they were told something that wasn't the truth. And so our company isn't all that special. All that we do is we spend a lot of extra time spending time making sure that we have good leaders, and we give them support, and we teach them what good leadership looks like, and we hold them to that expectation. They're supposed to care about their people, make sure they grow, hold them to high standards, coach them, be there for them, and care about the community and the people they serve. It's not that challenging. It's not that difficult. It's just sometimes when you work for a company that doesn't seem to be focused on that, you can lose the wind in your sails as a clinician, so to speak, and you become disgruntled and burnt out. And this is extremely common these days. And so a lot of people are thinking it's healthcare is the problem. Healthcare is not the problem. Healthcare is wonderful. Healthcare is there to help people get better. And so many people go into healthcare for all the right reasons and become disillusioned by the system that they're put into. And the system has been taken over by greed and money and corporate speak and, advertising of things that aren't real. And, I could talk about, Medicare Advantage. I could talk about some of the big corporate medical structures out there, and they're not in it for the right reasons. And most clinicians are in it for the right reasons. Of course, they want to make money. They have a family. They want to take care of them. But they also know that they want to take really good care of their people and be set up in a way, in a system in which they can do that. And we as a company have to be obligated to not only make sure that our patients are getting good care, because oftentimes the patients themselves don't know what good care is. So that company has to police that. And then also they have to make sure that they're trying to make things work well within the system for that employee. We have to set them up for success. And that means we have to make sure that they have the good training that they need to have passion for what they do. They have to love their boss. And I don't mean the company they work for. I do mean their direct supervisor. They have to love them in the way that, because they know that that direct supervisor is coaching them and wants them to be successful and wants the right thing for that patient. They also want to work on a team that has each other's back. They want to know that they're going to hold each other to high standards, and it's still fun and enjoyable. And there's good. You have to have mature people managing and running a company in order to help teach people what healthy boundaries are and what work-life balance is supposed to look like in healthcare. Because I think a lot of people get lost and it sounds good, but they don't know what that means in practice. And so they need to feel like they're well compensated, and they need to be proud of the company they work for and the industry they work for. Those are the 5 main things that people need in order to love what they do. I know that healthcare can be salvageable, but I think in some ways it's going to have to get worse before it gets better. There's going to have to be more providers who are going to step up and say, we want better. There's going to have to be more healthcare employees saying, we want to work for a company that is looking out for us. And there's going to need to be more patients that are complaining to the right people to make sure that these Medicare Advantage programs are not taking advantage of them, and providers aren't trying to cut corners more than the system that they're put in. Oftentimes as a provider, we're put between a rock and a hard place. We have insurances that deny care when we know that patient needs it, and so our choices are limited, and that's what's so frustrating to us as a company, as to me as an owner. And then also to our employees that want to fight for what's best. So we've had to hire a bunch of extra staff in order just to deal with the insurances to try to fight for more care, and going back and forth and continually being denied when we know that person needs the extra care. So it's a battle right now in healthcare. There's no bones about it. The clinicians that are in the field right now are frustrated. The small mom and pop providers are really frustrated. And these big corporations are raking in money right now, and it's at the expense of the customer and the employee.